Thank you all so much for being here. We know how incredibly busy this week is, and with the gathering of the 79th UN General Assembly, the fact that you've taken time out of your week to be here with us really means a lot. So thank you to everyone for being here, being willing to listen, being willing to bear witness. For those that I've not met, my name is Alicia McCormick, and I serve as the CEO of Last Mile Health. I work with a terrifically talented team pretty much every day to really look to see how we can close the health access gap, particularly in remote and rural areas, through the professionalization of community health workers. And I think many of you were perhaps at the Community Health Impact Coalition event earlier today. I do not need to reiterate all the virtues and sort of the proven effect of a professionalized community health worker in saving lives. I think we've known that for quite some time, and we're here today to talk a bit about the intersection of those that are at the front line of the health workforce and their lived experience around how the impact of climate and health is very intersectional, and what we can all do to better understand and respond to that. Thank you also to our colleagues from Macquarie, who have been such terrific partners, and also to our colleagues from J&J. Where's Aisha? There she is. We at Last Mile Health have been so fortunate to partner with you over recent years, and I think the integrity and the care and the values alignment that your teams have brought to our work has been something that's really mattered to us. We are going to hear today from some terrifically esteemed colleagues, 3 amazingly talented community health professionals that are sitting directly in front of me, and also from some folks that are actually doing the work and the facilitation within communities of health, communities and ministries of health within areas where we're looking at the intersection of climate. What I think we all know is that we are committed to this conversation today because climate change is the greatest threat to global health, and it disproportionately impacts the health and well-being of our most vulnerable communities. For rural and remote communities, the impact of these extreme weather events is especially acute. Drought exacerbates malnutrition. Flooding and extreme temperature lead to a greater burden of disease for things like malaria, and it can make travel to clinics for routine care, like prenatal checkups and immunizations, next to impossible. Strong integrated community health programs are essential to help vulnerable communities adapt to the health impacts of a changing climate. And community health workers like Margaret, Ramatu, and Bupe, who we're going to hear from today, are addressing the health impacts of a changing climate by maintaining access to routine care during extreme weather events, by serving as the first line responders, we thank you for that, to diseases like malaria and dengue fever, and by providing a trusted bridge to the health system for rural and remote communities. As implementers, funders, and policymakers, we must ensure that investments in the community health workforce are essential components of climate adaptation strategies. We will hear from panelists today who are at the forefront of this work. I'm very pleased to now turn it over to Dario Trum of Macquarie. Please come on up, Dario. And to Aisha Williams of Johnson & Johnson. Dario is the head of the Climate Intelligence Unit at Macquarie, which he formed in 2021 after a decade working across the energy transition. The work he leads for Macquarie supports the transition to a low-carbon economy, and Aisha Williams is the global head of healthcare workforce strategy for the Global Health Equity Organization of Johnson & Johnson. I wanted to make sure that that was a mouthful, so I think I nailed it, okay. Where she drives strategies that support nurses and community health workers, address care gaps, and deliver better health outcomes for patients globally. So Dario, over to you.
Sure. If I may, I'll also use the real table. If
I was the only one to have to look at notes, I would have felt badly, so I'm glad for you to do that.
So welcome, I'm your Macquarie host today. I'll try to keep it very short because I've done a bit of homework and it's just really humbling to see all the great things that the people who are going to speak today are going to talk about. So thanks for joining us in our new home, as I said, and what a better way to start life here than hosting this discussion. Last Mile Health was one of the 5 winners of the Macquarie Foundation's 50th anniversary award, and we're truly honored to have been able to support you with a 10 million Australian dollar 5-year grant, and hopefully there'll be more. A lot of the reporting on climate disasters tends to focus on the material cost. In our world of finance, we talk about stranded assets and how to fund the building back, but it's also evident that climate change is a major health challenge. And as you flagged, health facilities get wrecked, perishing harvests lead to malnutrition, and diseases like malaria are more prevalent in places that are waterlogged, and all the things that cause that to happen are happening more in a warming world. And although we're doing a lot of hard work on the climate mitigation side to slow global warming, unfortunately we have to prepare for these things to continue, because we're not quite there yet in terms of mitigation. Fortunately, in my role, I've also come across some of the ways climate change and health are connected in positive ways. The same solar panels and batteries we use to decarbonize the grid around the world can be used to power health facilities in remote areas. You can keep your medication cool, and things like that. So I think that's where hopefully our fights join, and we can achieve results together. And today it's clear that the innovation in clean energy and technology is enabling communities to provide fundamental services in ways that even just 10 years ago wasn't possible. But none of this would be possible without the people that are committed to make this happen on the ground, and I wanted to join Lisha in giving a particular mention to the community health workers that are here today. So Margaret, Roberto, and Lupe, thank you so much for coming. In my homework, I came across your stories, and I was really humbled by your determination and grace, and I think everyone here will learn something and be inspired by hearing your stories. So thank you again, and thank you to Last Mile Health. You have enabled us here to learn a lot over the last 1.5 years of working together through your work and impact, and I'm pleased to pass to Isha for the end of the opening remarks.
Thank you. Good afternoon, everyone. Good afternoon. I'm Aisha Williams, and as the very long title suggests, I lead Global Healthcare Workforce Strategy at Johnson & Johnson, which simply means I have the privilege every day to partner with and support all of our efforts for nurses and community health workers, who we truly see as the backbone of care, the first touch for so many to reach out and to have the quality, access, equitable care that they need. We know that on the one hand, healthcare is moving at a rapid pace. The solutions, the technology, things that we could only dream about in movies years ago. But we know that at the same time, there are many communities for whom gaps in care truly persist. And so at Johnson & Johnson, our commitment as our global health equity team is to try to bridge the gap between community and care for those who need it. We believe, again, that community health workers are at the root of that, as those with lived experience who can build trust, who can build relationship, and can truly help guide others to care. You have the hands-on experience, you have the insights, you're on the forefront of how climate is affecting health, you help lead people in the time of disease outbreaks, and we truly thank you for all the work that you do. That's why it is my pleasure to introduce our 3 speakers for today. As mentioned many times, Margaret Odera, Ramatu Jallo, and Bupe Sinkala. Women who are incredible and passionate leaders in their communities. And I want to give a full introduction of each one as they come up. But I'll tell you that each of these leaders have found creative and compassionate ways to connect with people in their communities who are disconnected from care. They will share with us what community health workers need to be able to join with all of us to extend care, to extend universal health coverage, to guarantee global health security, and to respond to these issues that we all care about in terms of climate's effect on health. I ask us as we listen to be inspired by their stories, to think about what we can do in our respective organizations to meet some of the needs that they say, as they share stories that are filled with joy, that are filled with hope, and they give true meaning to all that we look to accomplish together. I want to start first with Kenyan community health worker, Margaret Odera. Just a bit about Margaret. As an HIV-positive mother, Margaret uses her story to inspire others that there is life beyond an HIV diagnosis. An elimination of mother-to-child HIV transmission is possible. When she was diagnosed with HIV in 2026, her pastor told her that she was cursed and would die within 2 weeks. His so-called prophecy proved to be the push that Margaret needed to turn her life around. And Margaret remade herself as a survivor and as a voice for change. Please help me to welcome Margaret Odera.
Wow, it's such an honor to be presented in such a pitch. Thank you so much, my sister. Yes, and now I just want to tell you a short story, and it will take you. I'll take you on a journey on how community health workers work and what they need, and our own experiences and our own challenges, so that at the end of that story, you will see clearly what a community health worker needs. I met a woman in 2012. She was newly pregnant. Her name is Brenda. She tested HIV positive and immediately went into a panic. She ran out of that room. I had to follow her so that I persuade her to get back to the private room, and so that we may have a woman-to-woman talk. "I want to die," Brenda shouted. And I told her, "I am also HIV positive." She told me, "You lie." I had to convince her back into the testing room for me to be tested so that she may see that I'm telling her the truth. I told her that it is possible to live a healthy and strong life. But the moment I looked into Brenda's eyes, I saw myself in her eyes. She reminded me of the day that I got tested of HIV, the same devastation. And I told her that it is possible even to have a HIV negative baby. So Brenda asked me one question: if she could trust me. And I told Brenda, of course you can trust me. It is possible to have a HIV negative baby. And she told me, "I want to be close to you. I want to be close to you in this journey." And I said, "Of course, I'm going to walk with you in this journey until we see our baby HIV negative." I asked her, "Brenda, how will you feel when you see a HIV negative test on your baby?" She said, "I would be very happy." And then she asked me, "But is it possible?" I told her it is very, very possible. And that was a turning point for Brenda, because she could start to believe in a better future, because my own life was proof. My own turning point was very public. One Sunday, almost 20 years ago, I told a pastor, a man I trusted more than anyone, that despite praying for me for months, I still remained HIV positive. He simply told me to meet him the next Sunday. Little did I know what was coming. So the next Sunday, the pastor came in front and stood me up from the congregation. And he told me to come where he was standing. And then he told the congregation, "These are the people that are destroying our names for their lack of faith. Margaret, you have 2 weeks to live. I have nothing else to tell you." Then he pointed at the door on his left and said, "Ebu toka tuonane mortuary," in Kiswahili, which means, "Get out, see you at the mortuary." And in that moment, I could have resigned myself to death, both physically and mentally. But to my surprise, I did not cry. I had already cried out all my tears. Or maybe it's because I had already received many insults from the community. So this hardened me that I did not cry. But I purposed that I am not going to die. So I say to myself, no, I'm not going to die. Not this time. And that is the strength of community health workers. We have gone through the trials, we have gone through the humiliation, and our patients trust us so much because we know what it's truly like. But these challenges are growing. 95% of my community members live below poverty line. Malaria parasites keep mutating, and climate change has brought even more uncertainty in our country. I was most affected by the floods that took place in April and early May. I saw a young lady holding on into a twig in the middle of the river. It was so devastating watching her hold on to that twig for more than 1 hour before she got tired and resigned to the waters. She left that twig and eventually sank in the water. Other community members disappeared. When houses near the river banks were washed away, we had some of them, I have no traces on where they went up to this moment. Memories of fear and unexpected still haunts our community, and the floods have already returned. Right now we have very heavy rains in some parts of our country. And in the middle of these many very heavy rains, we have experienced schools that have been submerged in water. Right now at a boarding school, there were hippos and crocodiles that were encroaching a girls' primary school, which is a boarding school. So this scared me so much. Climate is really affecting our country. Now, what do I want you to know? I want you to know that the community health workers are human beings with our own families, needs, traumas, and stories. It makes us very strong in what we do, but also means that we need support. Community health workers need better salaries, trainings, so that we can keep passing long good health and power to our community. The natural disasters only make our community more desperate for support that only the community health workers can provide. Remember my pregnant patient, Brenda? Brenda herself is now a community health worker and a mentor mother, helping other HIV-positive mothers. Thankfully, she has a son and a daughter who are both HIV negative. She is passing on the support and the hope she received too. But that is exactly what we do. When we are empowered, we transform community health, and community health is what transformed the global health. And in this short story, I believe that you have seen the need of community health worker in global health security, in the universal health coverage. I am an example of a community health, being a person who was saved by a community health worker. So in this short story, I'm not going to waste any more time. I will leave it at that. Thank you so much.
Thank you so much, Margaret. There's something so powerful about a story. And I like what you said, that you saw that woman through your eyes. We don't have to be from different parts of the world or have the same exact experience as someone else to be able to see them through our eyes. We all know what it's like to want to care for our children, to want to care for our community. And with the climate impacts that you mentioned, hopefully it encourages us all even more so to act with urgency as we can see ourselves and others. Thank you for that. We have two more amazing stories to hear. And the first is coming from Ramatu Jallo from Sierra Leone. Ramatu has been a community health worker. Feel free to come on up. Has been a community health worker for 12 years. During the COVID-19 pandemic, Ramatu saw firsthand that more support was needed for the immunocompromised. By sharing her own battle with HIV, she was able to secure protection for more frontline health workers. In fact, her passionate advocacy led to the COVID-19 Action Fund for Africa, which has so far raised $20 million. And now she's using her role as a community health worker to advocate for more support for the growing challenges caused by climate change. Thank you, Rona.
Hello. Good evening, everyone. Straight to the point, no time to waste. I'm already been introduced by her, but the story I'm about to say here, I was born and raised in the eastern region of Sierra Leone, Kono District. Is the home that the world has known to be the home of diamonds. That's why we have so many minings. And when the 11 years civil war struck down everyone in that country, poverty became part of the society, which led today thousands are doing deforestation because they use the firewood, they use the stakes to produce firewood, cooking coal, building houses for source of sustainability. And the place is already a wetland, greenish, and now it gets more wetter when bigger mining companies took over. So we have more swamp and flooding in the rainy season. And the rainy season is very long in that part of the country. Even when the rain ceases in other parts of the country, the rain continues in Kono District because of the mining. And these swamps, where the mosquitoes live, and these mosquitoes carry the malaria with them. So malaria has been part of our daily life in Sierra Leone, especially Kono District. I know some of you don't know what is malaria, but who feels it, knows it. So the story continues. So our people are suffering with malaria, then they have, the only contact they have is the community health worker, because we are the trusted messengers. What that person in the community can tell a community health worker, she or he can never tell a doctor. So they being diagnosed with malaria, struggling of how to get the medication. At the same time, what makes the medication works? Social support. Social support. If anybody is here, help me tell them I said social support is needed. Taking the medication is not enough, because you cannot take the medication without food. As time goes on and on and on, we appreciate partners, we appreciate donors, we appreciate the government, but still it's not enough. As a woman in my community visited me repeatedly before I met her, she's begging me to accompany her to the facility because I'm working for Partners in Health. I'm here representing Sierra Leone, but working for Partners in Health. I try to accompany her for us to find out what is her problem, because she's complaining about common cold. 5, 6 people live in the same room. If one person contacts TB, everybody is a victim. That is the life our people live. I accompanied her, believing that maybe they will test her TB positive, but I was wrong. She was tested malaria positive. My journey began with her. Because the power of the community health worker is not just to accompany the patient or the community member to the facility, but there the journey will start between you and that particular person. Because you are going to be the source of her strength. You are going to be the trusted family member. that she will look up to. That's why I'm happy today for Partners in Health in Sierra Leone as they implement the 5S. Staff, stuff, space, system, and social support. So this lady, I started following up with her until she became stable, but taking her medication becomes a problem because she don't have food. She's willing to take her medication, but no food. Until I continue to counsel her and advocated for her to the social support program implemented by Partners in Health. So she was supported, and today she's healthy and happy. But let me tell the whole world here today, if we want health lifestyle to be part of the world, we must invest in community health workers. Equipped us, paid us, not talking. I'm not talking about stipends or talking. I'm talking about community health workers should be paid. If you are not infected, you are affected. Is there anybody who is not living in the community here? Yes, maybe in America here or somewhere, but Africa, everybody lives in a community. Because I see in New York here, bigger buildings, everybody in his own apartment. Nobody talks to anybody. Yeah, but in Africa, we are community everywhere. And if we must achieve the universal health coverage, community health workers should be at the center. We should be at the center. So I don't want to continue much, but I want to rest my case here. I just want to send this message to you. Ask yourself, what is your contribution? What is my contribution, which I'm doing it now, to promote health, for health to become a lifestyle of all? Don't say, I will never be there, but care for someone who is there. Thank you, I rest my case.
You have rested the case. Thank you. Thank you. Not much more to be said other than the feeling that you just gave us. You gave us a feeling with your story. That's the feeling that community health workers give to the people in their community. We can't replace that. It's the relationship and the trust. Thank you. Last but not least, we want to hear the story and impact of Bupe Senkala, a community health worker from Zambia. Bupe's life came crashing down when she was diagnosed with HIV. But with the support of family and a job as a community health worker, she has found joy. Working from mothers to mothers since 2013, Bupe advocates for community health workers to be recognized as professionals for the work they do. As a professional community health worker who gets paid for her work, Bupe is able to take care of her daughter as a single mom, and she has big dreams for both her daughter and herself. Please help me to welcome Bupe.
Is it good afternoon? Still trying to keep up with the time, and it's definitely not easy to be last. But I would try my best to take you through my story. So, have you been frustrated that you cannot see your doctor, or that your next appointment is not for weeks or days? And imagine how many doctors and nurses feel like there are not enough hours in a day for them to give their patients the emotional support they need. And back home, we're adding this to a cholera outbreak, which is caused by heavy floods. And this has mixed with the drinking water. And when you ask some of your clients to wash their hands, and the water is not even enough for you to do the same as a healthcare worker. And adding on to this, we also are experiencing drought. And this has made good nutrition hard to find and expensive. And so it is definitely clear that the climate crisis is a health crisis. And even though we're going through all these challenges, I know there is hope. And while the challenges and the challenges in climate patterns are adding a new layer of challenges, my experience shows that we can adapt and we can respond quickly while ensuring that we give our clients the support they need, and it's also client-centered. You see, I am a community health worker, and I am also living with HIV. And what gives me hope and my power is that I know exactly what my clients are going through, because I come from their community. And so being a community health worker, I was inspired to help others because I got that help from community health workers and from my family. And because you have clients like Imelda, who are also looking up to me as a community health worker. She is a mother of 3. She has a child aged 14, 9, and 11 months. And she had her husband, but he recently passed away due to cholera, which left her to provide for her family alone. And now, being a single parent, that is definitely not easy. And so for me, as a community health worker, I ensured that I was there for her. I supported her emotionally for her to get through her loss, and also for her other health challenges, because she had hypertension due to everything that she was going through. And I also ensured that she also continued to adhere to her HIV treatment, because that's also very important. And because community health workers, and especially at Mothers to Mothers, we are a one-stop shop. We make sure that we tend to the different health needs of our clients. So we look at TB, malaria, and also non-communicable diseases like hypertension I have mentioned. Being a community health worker also means that I go door to door in the community. I take time to see my clients. I do not only see them for 5 minutes. I sit down with them. I go to their homes, have a one-on-one session with them, and just try to find out what they are going through and ensure that I can pick them up, I can encourage them, and make sure that they get to a point where they can make informed decisions and be productive in society. And I also not only give health education, but my fellow community health workers and I ensure that we also engage the community. We make sure we talk to community leaders to ensure that there are more clean water sources in the community. And then we also give more health education, ensuring that we educate our community. When they see symptoms of a client with cholera, they quickly can rush them to the facility and not treat them with traditional medicine, because that's definitely a norm in, like, back home. You'd find they'll tell them to drink something and instead of come to the health facility. So what do community health workers need for us to do our job, and urgently? I am going to use my fingers so that all of you can remember this. 1, we need to be paid like any other person that is working. We need to be trained and supported with equipment. And we need to be recognized, and we definitely need more of us. I have overcome many challenges in my life, and so have my peers. And I know we can keep winning, but we cannot do it alone. So my ask today is, we need more investments. We need more community health workers for us to be able to do the job that we know best how to do. Thank you so much.
Thank you so much, Bupe. Thank you to Margaret, Ramatu, Bupe for your stories. We hear the message loud and clear. Community health workers have a unique place to play, and you should be, and all of community health workers should be recognized, paid, and supported for your work. So thank you. I'd like now to ask Dr. Vanessa Carey to come up, CEO of Seed Global Health, so we can have more on this topic from our panel.
Thank you. Good afternoon. It's only is it Monday? I just want to start by saying thank you to the three of you for coming here to share your stories, more importantly for all the work that you have been doing and for calling us all to accountability for what is needed in this moment. I'll come back to that in a moment. So just it's been introduced. So I'm Vanessa Carey. I'm the CEO of Seed Global Health. I'm also the World Health Organization's Special Envoy for Climate Change and Health, which is why the conversation we're having today is so critically important, because it is literally the merging of the two things to me that matter most, which is health workers and climate change, which is really the existential referendum on our humanity. And so to think about what we can do in response, I couldn't think of a better place to be than an event that is being hosted by Last Mile Health that has been on the forefront of ensuring that there are safe communities throughout this world, being advocates, more directly providing work, and with gratitude to Johnson & Johnson for being a leader in this space and for really thinking through how do we respond and be accountable, especially as a private sector partner, and to Macquarie that I am learning about and very excited and grateful for your leadership too, because you were also stepping into this and outside of the traditional bounds of maybe where you worked before to be a leader in closing health equity gaps. And that's the exact kind of response that we need right now. I am actually going to ask our panelists to come up for a moment if I can. So we have today, I'm going to mess up names, but Rustin, will you come here from, I think you're just in front of me, forgive me, come up. Thank you very much. We have, who's the Director of Health System Strengthening at Last Mile Health, another thing dear to my heart, Health System Strengthening. Dr. Johanna Sanchez, Senior Program Manager for Climate Change and Grand Challenges Canada. And Sarah Bender, the Managing Director for the Solve Family Foundation. And then while you sit up here, I'm going to just take a quick moment to frame our crisis for a second. The topic we're going to talk about today also matters to me on a very personal note. I may have trained as a critical care physician, but I am also a mother of 2 small children, and more importantly, I represent right now, in this moment speaking, an extraordinary team from 4 countries around the world that has been on the front lines of trying to help their ministries respond. I am a friend of Last Mile who has been on the front lines of doing this and really trying to be responsive to communities. And what we're learning is that we heard already the climate crisis is a health crisis. And so I want to thank the 3 of you because you have advocated for what needs to happen. One, you spoke about the shared experience, right? Seeing through somebody else's eyes. We live in a fractured, tumultuous world where we are in crisis, but we are living through a shared experience where we have to learn to see through each other's eyes. And to feel that shared experience and to feel the same sense of commitment and the same accountability and the same deep, bold ambition to solve this problem in a very different way. And that does mean paying community health workers and ensuring that you are recognized and you are not just paid a stipend, but you are paid for the investment you are making in the community and the return you are bringing through your work. And it is unacceptable in 2024 that we're not doing that still. We need strong, resilient community health workers. Strong, resilient health systems that are founded from community health workers that are working at the last mile to be vulnerable, connected to the part that we try to play, which is to the workforce that you can have as a referral chain in an effort to make sure that everybody is working in tandem at the end of the day to meet the growing burdens of disease that we see in climate change. So that is what we are here to talk about. We're here to talk about a continent that shoulders 1/4 of the world's burden of disease and has only 4% of the healthcare workforce to meet that burden, only 1% of the world's healthcare expenditure, a continent that is the most vulnerable to climate change in the world, something that it is not responsible for creating. And really to talk about how that continent represents what we face for all of us and the leadership that all of you are bringing every day in your work that you guys are going to talk about with us today about how we respond to this. So It is a great privilege to be here to talk to you. I'm just going to take a quick moment to introduce our panelists. So T. Rustin Yanko is the Senior Director, and forgive me if I butchered it, please correct it, is the Senior Director of Health System Strengthening at Last Mile Health. And since joining Last Mile in 2019, you've overseen Last Mile's health partnership with Liberia, which is just an extraordinary legacy of impact. And you built a coalition of stakeholders to scale Liberia's national community health worker program. Sarah Bender is the Managing Director of the Solve Family Foundation, where she supports organizations that contribute to transformative change at the nexus of the environment, public health, and livelihoods. She was previously the director at the Audacious Project, which is a funding initiative housed at TED. And you've supported some of the greatest change makers to tackle societal challenges. So thank you. Joanna Sanchez is the Senior Program Manager at the Climate and Health and Grand Challenges, where she's leading the development of the new Grand Challenge program on climate and health. Prior to joining Grand Challenges Canada, she worked for over 15 years in research, health, and academia, completed both postdoctoral fellowships in epidemiology and environmental health. So I want to thank you all for joining, because you all represent very different backgrounds, very different perspectives, but with this shared mission. So if I can, I'm going to start with you, Rustin. In the remarks we heard from our colleagues here, they shared a call to action for all of us to recognize community health workers as professionals and invest in the community health workforce. A robust community health workforce is without question essential to responding not only to challenges we face today, but to responding to providing everyday care, emergencies, pandemic preparedness, and now climate change. So how is Last Mile Health and its partners equipping community health workforce? You heard some of the calls and needs to be able to respond to climate emergencies. I'm going to park it there, but I'm going to keep my notes. I'm going to hand you that.
Yeah, thank you. Thank you so much for having me. I'm excited to join this esteemed team of panelists and to also join community health workers from around the world. I'm really excited and was really motivated by the story I'll share. So Last Mile Health has been working with the government of Liberia, specifically, to equip community health workers using what we call the 6S model. So the 6S model takes into consideration making sure that community health workers are salaried, they're supervised, they are skilled, and they also have the requisite supplies, and all of these are integrated into data systems and ensure that they are skilled nationally. And so we use the 6SS model to make sure that community health workers are prepared to respond to time of crisis, like climate crisis, but also are ready to respond to time of calmness. As most of us in the room already know, Liberia is home to one of the world's largest rainforests. And that rainforest is also home to almost 30% of the country's remote population. And these people live beyond 5 kilometers away from the nearest health facility. And so Last Mile Health has been working with government to make sure that community health workers are equipped in time of climate crisis to be able to respond to these conditions. So providing like rain gears, in cases of massive flooding, how can community workers are prepared to respond to crisis. And one thing that continues to pop up is that when we have these extreme climate weather conditions, community health workers are cut off from these communities are cut off from the rest of the world, technically, because you have massive flood that prevent people from accessing desperately needed services at the community level. You have sometimes erosion that just cut roads that people cannot access health services. So so Last Mile Health has been able to preempt some of these things by providing like rain gears and other supplies that help community workers to be able to respond to these conditions. These floods also cause waterborne diseases to really scale up in these communities, and also water and sanitation. So access to safe drinking water also become a challenge as a result of massive flooding. So making sure that the community health workers are equipped with the requisite tool to respond to these emergencies is really, really critical. And finally, I also want to say, not just the community health workers, but the supervisors must also have the right equipment to be able to support the total supervision, because making sure that community health workers at the point of care have the requisite skills and can perform up to tasks, you need the supervisors to also be equipped to reach to them at this point. So far, those are some of the work that we are doing.
It's some of the work that's quite extraordinary. I don't know if I have a microphone on. So there we go. That's really, I mean, that's an extraordinary contribution and example to be setting forth. I'm going to have you pass the microphone actually down to Sarah. The Saul Family Foundation has been particularly focused on locally led solutions and even investment areas like the intersection of climate and health. Thank you. We need more of that. But we're still learning and experimenting on how to find the right path. This has sort of been a new awakening for many in the world, and you guys have been very much on the forefront of this. What do you want other prospective funders to know about why investing in healthcare workers at this moment matters, and how that actually relates to the climate crisis? It'd be very important for many of us, please.
All right, well, thank you for that question. It's wonderful to be here today, deeply humbling. I have been at the Saul Family Foundation for 3 weeks. So forgive me for my notes. Prior to that, I was at the Audacious Project, where we had the pleasure of supporting Last Mile Health as one of our cohorts. So given that, in terms of what I would like for other funders to know, I think the stories that were told today are really the most powerful, more powerful than anything I could say in terms of the lived experience, in terms of all the hard work that you all are doing. So, but how can we kind of think about that from the sidelines and support that as a foundation? Saul Family Foundation is focused on supporting the kind of thorny intersection of environment, livelihoods, and public health, and community resilience kind of cuts through all of that. Last Mile Health has been a partner since 2014, I believe. I'm just going to read a little bit from my notes here, but when that initial project went out, we were really focused on supporting healthcare workers to enable, of course, better access to healthcare delivery at the community level, to strengthen the systems by integrating community healthcare workers into national frameworks, to improve, of course, overall health quality of service and accessibility, and in recognition of this really important intersection between supporting those workers and climate change. And so I have a couple of, I believe you all know this already, but kind of how Saul Family is thinking about this important intersection, why it's so important, our perspective here, is one, that the local knowledge that community healthcare workers bring and the trust. Each of you really emphasize that. You know what's happening, you know where resources need to be directed. You know the health impacts that are happening in real time. All of that can then be put into data that is needed for advocacy, and to bring that data into advocacy at the policy level. How do we really make changes so that communities are resilient in the long run? And then also just to end by saying that you all are working with the most vulnerable individuals where, as we've said and heard many times, climate will manifest itself the most. And so having community healthcare workers at the table is critical. In terms of sharing that with other funders and trying to get the needle moved, if you will, and more funding directed, I think taking the approach of recognizing that none of us, even in our personal lives, are living a single issue lives. All of these issues are thorny, and so we can't just take a kind of singular view of how to solve them. We have to really bring multiple individuals to the table to do that.
Thank you. And I have to say, 3 weeks or not, you represent a really extraordinary history, though, being engaged in this work and thinking differently. And the fact that you came from something that was audacious and you're now at the Saul Family Foundation, it's the whole idea, right, of doing something different, leaning into the spaces that we need, asking the questions and hoping to push us all to be able to do the work that we do. And so at the end of the day, this whole room has power. We are here in New York. We all have the ability to create change in what we do, and you're doing that just by being here and representing. And so thank you so much.
Thank you.
It really, truly. Joanna, Grand Challenges, it's for you. Grand Challenges brings forward community-driven innovations at the forefront of emergent challenges like climate and health. What are you seeing so far in your work to support innovators, entrepreneurs, and researchers in this space? And how do we keep pressing ourselves beyond initial ideas to learn and iterate and keep pushing to provide that long-term sustainable impact?
Thanks for that, and thank you to the presentations. There were very powerful messages that came through there, and hello to everyone. Sarah actually said a lot of words that will lead very well into what I'm about to say. So Grand Challenges Canada, we are an impact first funder. We are an innovation platform. We fund work in low middle income countries through supporting locally led innovations. We believe that the people, local individuals are best placed to find the solutions to global health humanitarian problems. I recently joined GCC as well, a little longer than 3 weeks ago, but 5 months ago, to lead a new climate and health program that we are developing. And so we fund through grand challenges. We identify grand challenges and the critical barriers to overcome them. And so my work has been essentially scoping the field, the climate and health space, and understanding where we fit in there, because we absolutely want to be a player in that space. And one of the things that has come out in the preliminary scoping is the lack of local input in deciding where to place funds. I've had several conversations with experts, other funders, and local organizations, and it was in a conversation with a group of community healthcare workers in Kenya that they actually said, ask us, we can tell you what the issues are. There should be nothing about us without us. Let us have a seat at the table, which is what Sarah said earlier. We can answer so many of your questions. So we want to engage healthcare workers in this scoping activity. And so what we're going to be engaging on is we're going to be developing a global survey that we're going to be launching, hopefully December of 2024, to healthcare workers in low middle income countries, community healthcare workers, physicians, nurses, also researchers and scientists, innovators, and ministries of health policymakers. We also want to hear where everyone sees the priorities. We suspect that the priorities will be different in the different regions of the world, but we want that to be community driven. We want the community to tell us that what the priorities are. Some of the barriers that might come out, I suspect, are going to be the lack of capacity building, the lack of community healthcare workers prepared to support this climate crisis. But we want to hear that from the communities. And so stay tuned for more of that. This will be something that we hope to launch quite widely, and we will require partnerships to cast the net as wide as possible. We are partnering with the Geneva Learning Foundation, who has a network of over 50,000 healthcare workers, most of them in sub-Saharan Africa. We are working with organizations and partners all around the world, and I will continue to be reaching out to everyone to send out the survey, because what we want to do is we don't want to hold on to this information for ourselves. We want to create a public good document that will essentially provide a list of Grand Challenge identified priorities all around the world that we will share through an open access publication that other funders can use to hopefully identify their own priorities of scientists, researchers, and even local government and policymakers, decision makers, to help them guide decisions as well. So we really need to work together on this, and Grand Challenges Canada really wants to lead on that front and partner with everyone. In terms of the next question that you asked, how can we take our solutions to scale? I think if we can work from the beginning with the communities to actually identify what the problems are, what the challenges are, I think we're more likely to be able to take solutions to scale. And that's something GCC is very committed to do within the next 5 years, one of our priority areas. It's not just take things from proof of concept to transition to scale, to take them all the way to scale. So make sure that we have the right partners. And I think by identifying the correct problems from the onset will help us do that more effectively.
Thank you for that. We're going to actually move right into a lightning round, because we are already in our last question, even though it's been, but it's an important one. When we hear a lot of dire facts, we hear a lot of doom and gloom. We spell out the urgency because we're trying to create action, which is important. But we also need hope, and we need to know that we can come together to create something different, and we've seen that through the work of Last Mile, through the words you all shared. There's a lot to hope for. There's a lot we can create, a lot we can do differently. So in 30 seconds or less, I know who wants to go first. I want to know, I want to hear from you, what gives you hope? Where do you see the optimism here? Who's going first?
Can we start?
Yes, please, Joanna, go.
Well, moving from academia, moving to the funding space, I think what's given me hope these last 5 months is, first of all, how amazing the space is, the climate and health, the global health in general, but everyone's willingness to talk to each other, to work on this problem together, recognizing that it is a global problem. And when I speak to people at various levels at different countries, people in South America say, tell us what India is doing, we want to work with them, or tell us what Africa is doing. And Africa is saying, tell us what Indonesia is doing. Everybody wants to solve this together. We want to work together, and I see a strong willingness to collaborate. And that gives me hope that we want to come together as a world to solve this.
Excellent, thank you. Sarah?
Okay, I have a few. I'm an optimist, so I have lots of hope here. One, in the space of philanthropy, that there is an increasing momentum around trust-based philanthropy and participatory grant making, where those who are on the front lines are the ones making the decisions about where the funding is going. So that gives me great hope in terms of getting more private funding to this issue area. I have a lot of hope drawn from the stories that, again, the three of you shared. And there's hope that there are solutions. So, Lupe, you read it out perfectly. Solutions: paid healthcare workers, trained and supported with equipment, recognized, and the need for more. So we have the solution. The funding is moving. That all gives me great hope.
Thank you. Weston, take us
Yeah,
home.
thank you. Yeah, sure. So what gives me great hope is the fact that people have now recognized the threat of climate change on health. And now it has now become a collective effort. So from the highest level of government to communities, people have now begun to make decisions to prevent the impact of climate on health. So these conversations like this continue to give me that inspiration that irrespective of what is happening, there's hope that we will find solutions, innovative solutions soon. Thank you.
Thank you. I want to thank this entire conversation and everybody here for participating. I think that at the end of the day, the very bottom line and what gives me hope is the fact that I've seen time and time again that health workers are the answer. Whether it is the community health worker, the family medicine doctor, the midwife, the nurse, they are on the front lines of responding to every emergency that we see. And they do it. And they're going to continue to do it if we support them. But they are one solution for all problems. But that gives me hope, because that means if we do our jobs well, we scale up the community health workers and the support that we need, we scale up the referral chain and the midwives and nurses they can refer to so they can get definitive care, then we are ultimately really able to transform lives, respond to climate change, be pandemic prepared, and demonstrate an extraordinary return on investment so that people understand the value of this investment. And so I think the final thought that I think is important for all of us to remember as we are in Climate Week and UNGA is that we're not actually supposed to be in this fight to measure or abate the degrees Celsius, right? We're here to save lives. That is the fundamental end, right? We should be measuring in lives saved. So it is a deep, deep privilege to pass this back to Alicia, who's been on the front lines of making sure those lives are saved. Thank you.
That is a tough act to follow. Vanessa, thank you. I am so grateful to you for being a collaborator in this work, and I think you are just in the perfect place. The WHO could have not picked a better health and climate ambassador, so thank you. All right, thank you all. I feel like this was an extraordinarily powerful panel. Thank you so much, Sarah, Joanna, and Rustin. Thank you also, Margaret, Bupe, Mbabo. Really, really, really appreciate you, Rama. All right, I think that this has been a great gathering. We're so grateful to our friends from Macquarie. We're so grateful to our friends from Johnson & Johnson for helping to facilitate this conversation. I was looking at my talking points while I was getting ready to stand up and sort of close us out. And one of the things that I was seeing is that what I was noted to say is that only 1% of climate funding goes to health. And I think I would like to reject that, because I do not want to buy into the idea of a scarcity mindset that means that giving to one means you cannot give to another. And I think that that's true in our intent. I think that that is true in our actions. I think that that is true in our activism. I think that that is true in our investment. So when you think about the action, the investment, the work that you're going to take around climate, think about it through a health lens. And when you think about the activism and the investment that you're going to take around health, think about it through a climate lens. These things are intersectional, and we cannot escape that. With that, thank you all. We are going to hang out for a little bit of a reception. You can keep the conversation going. And just really appreciate you all taking the time during this very busy week to join us. Thank you. Thank you, Dr.